Hello friends, I am Dr. Ajay Kothari. I am a consultant spine specialist at Sancheti Hospital, Pune. 20th October is World Osteoporosis Day. Now what is osteoporosis? Osteoporosis is weakness of the bones, fragility of the bones, because of which bones get fracture very easily even with a trivial mild trauma. So what happens is, in a patient who is young or middle-aged, there is a phenomenon in which there is a bone formation and that new bone replaces the old bone, and that's how the cycle goes on. But as we cross the age of 50, this metabolism slows down, wherein the new bone formation pace comes down, and because of which the replaced bone is not filled in by the new bone, and there's where osteoporosis happens. Osteoporosis is a very major cause of disability in elderly people and major cause of hospitalizations and fractures, and a big burden on our economy and for individuals' pocket also. Now, what are the causes of osteoporosis? So the major causes are calcium deficiency, vitamin D3 deficiency, protein deficiency. Initially, it was thought to be a disease of elderly, but with the changing modern lifestyle, we are seeing a lot of young people getting osteoporosis. And thanks to the eating habits, the fast food culture, the addictions, smoking, alcohol, and extremely sedentary lifestyle, no outdoor games, no activity, and lack of sunlight exposure. What are the symptoms? How do one come to know that he or she has got osteoporosis? So unfortunately, many of the times osteoporosis is asymptomatic, and the only way that one comes to know is when a person gets a fracture. Now, the other symptoms of osteoporosis are joint pains, either may it be a knee pain, back pain, on little exertion, and fatigability in general. One important caution: women after their periods get over, that is post-menopausal age group, or females who have undergone a uterus removal surgery, that is hysterectomy, or elderly male after their age of 60 are at a higher risk of osteoporosis. Now I'll take a minute why females after the age of 45 to 50 are more prone for osteoporosis. There is a reason for it. There are two important hormones in females, which are estrogen and progesterone. And when these hormones, they are in peak at 40 to 50 years of age in any female, after 50 years these two hormones come down. These two hormones have got a protective and bone building mechanism. But when this estrogen and progesterone comes down, then the protective mechanism on the bone is lost, and that's why female after the age of 50 are more prone for getting osteoporosis. Now, how to diagnose that one has got osteoporosis? Number one is a clinical parameter. Number two are parameters like blood, wherein you check hemoglobin, you check proteins, calcium, alkaline phosphatase, vitamin D, and parathyroid hormone. Also, you can do tests like X-ray. But the gold standard for this diagnosis is DEXA scan, dual X-ray absorptiometry scan, wherein you exactly come to know how much bone deficiency is there in one's body, and there is a T-score leveling, wherein T-score below minus 2.5 falls into very severe osteoporosis, and that is a condition wherein you should meet up your doctor. Now, who should do DEXA scan? So any female after the age of 50, or if somebody has got higher risk factors like very high sugar, uncontrolled diabetes, Cushing's syndrome, rheumatoid arthritis, these patients are at a high risk and they should get that DEXA scan even after the age of 40 years. And after doing these tests, they should meet their doctor in order to start the treatment. Prevention is the best cure. The best treatment for osteoporosis is getting diagnosed early, and treatment should start early. That is the key part. Now, what are the treatment parts? So if one gets osteopenia or osteoporosis, I think there are two ways of treating it. One is a holistic approach and one is a medical approach. So when we talk of a holistic approach, in that, get early morning sunlight between 7 to 10, do weight bearing exercises, eat healthy, eat high protein diet, eat diet rich in calcium and vitamin D like green leafy vegetables, salad, fruit, sprouts, milk products, dry fruits. All these things have to be taken. Along with that, absolutely no addictions like smoking and alcohol. Lifestyle which is sedentary should not be encouraged. And 7 hours of sleep and stress-free mind is very important. Now coming to the medical part of osteoporosis management. So initial stages, we give calcium and vitamin D tablets. If there is osteopenia, then there are newer tablets which can be given weekly ones or even monthly ones, which are called bisphosphonates. If there is severe osteoporosis and fragility fractures have already happened, then there are newer molecules like teriparatide, which are like insulin injections which have to be given daily once, maybe for a period of 1 year or more. There are yearly once injections, 6 monthly one injections, which also are available, and they have revolutionized the treatment of osteoporosis. So dear friends, take care of your bone. The person who has got the strongest body, fittest body, I think is the richest person on the earth. So take care of your body and take care of your bones. Thank you very much.